So I am excited to present with Leah on behalf of Team 2. Our proposed solution is entitled Empowered Voice in Pregnancy, or MVP for short, because every pregnancy is valuable. And our team member is Rogelina Walker, who is a community midwife in the Las Vegas area. Leah Casada, who you'll hear from shortly, who's a software engineer, and then myself, I work as faculty at UCSF, and specifically as a maternal fetal medicine specialist. So I'll turn it over to Leah to walk us through our problem.
So yesterday's presentation was really shocking. It was disheartening to hear about the disconnect between Black mothers, Black women, and adequate healthcare. So you can read this prompt about a little bit more in depth about what the problem that we'd like to address in our app is. Or actually, I'll just read it. So our problem that we're addressing is people with the capacity for pregnancy, particularly Black women, are far too often disempowered from achieving the pregnancy outcomes they deserve because of lack of equitable education and care before and during their reproductive lifespan, resulting in avoidable maternal and neonatal morbidity and mortality. So the solution is an app. We were thinking of leveraging AI to make the app very welcoming for users, and they would input their information and we would return a report or further resources to help educate the patient and advocate for themselves when they return to their healthcare provider. This app supports them, in understanding critical aspects of their health.
Sorry, my neighborhood is noisy. So one of the things that we wanted to sort of put forward is some of the language and how we will propose the users be able to navigate the app. And so on the landing page, I think we want to make sure that patients know that we're really, or users, I should say, know that the goal is really to optimize their outcomes, and that we welcome people to use the app even before they become pregnant, or if they're looking to support others in their pregnancy journey, but make it very clear that the goal is not to actually provide direct medical advice or replace services from a healthcare professional. And on the homepage, we sort of envision different threads or arcs that users will have kind of in the app. So one, as a MFM, I love seeing people preconception. I think there's a lot that can be done to empower people to have better outcomes, to know what to ask their primary care provider for, things that they could do to optimize their health. And so people who are thinking about becoming pregnant, those who are pregnant, those who might be recently postpartum, people who are just there to learn. And then we also want to have a space for people who need help advocating for themselves in that moment, with tools and resources about even strategies. Some people might be familiar with a tool called the Brain Talk tool, but giving people things that they can use in their clinical encounters to feel more supported. And this is an example of a page. If the user were to click that they are pregnant, is recognizing that every pregnancy is unique. And one of the things that would be really helpful is getting curated information about the user so that we can help them get focused recommendations based on comorbidities that they might be entering the pregnancy with, their prior obstetric history, but recognizing that everybody might not want to put that information in an app. So we'll give people different options. And please keep me aware of the time, because I realize I'm not checking. The goal will be to get information from patients about how they're doing in that moment. And one of the things that we talked about in our group is that one of the we do want to be able to check in also on patients or individuals, users, emotional and mental state as they're navigating the app, and sort of offer resources, including mindfulness resources in the process, but to also check in on specific updates since they last used the app, about diagnosis or care that they've received, and curated sort of symptoms and vitals checks. So if they're in the first trimester as compared to the third trimester or postpartum, there are different symptoms that would be important to draw out from users to be able to then give them advice about next steps. And then, of course, health history is very important for us to be able to offer curated information about medications or things that they should be on or be offered, considered, resource assessment so that we could offer connections to external resources like findhelp.org if needed, and then to think about their care team and to use the platform or the app to actually be able to invite community or support members to kind of learn alongside them about things that are going on in their pregnancy. And one of the big things that we're hoping for is to also help use information that they're putting into the app to communicate back with their clinicians. And so we envision that the MVP will also have like a place for those who desire to kind of have like a playbook or things that that will have resources. Urgent sort of plays would be things of like if they input a blood pressure that's very elevated, to talk about next steps, about calling their healthcare provider, about recognizing that this might be a complication, you know, what complications might come up, and to be aware of the tests or things that might be offered, or if not offered, that they should be asking for. And then videos, podcasts, a clinical recap, which would be, we envision medicalese, but sort of sharing out that information that we collect in a user-friendly way from the app to a healthcare provider, including recommendations and references to guidelines to support those recommendations, and then other resources, like where they could find a doula, example, frontline doulas, or that sort of thing. Sorry.
All right, I think we're at time. Did you have
Okay.
like one more slide?
I think that, no, that's it.
Okay, perfect.